My name is Jordan Klebanoff. I'm one of the Christiana Care OBGYN residents. I'm here with two of my co-residents. This is Dr. Shivani Shah and Dr. Kerry Campbell. And what we're here today is to discuss some of the most frequently asked questions by patients regarding a Foley bulb induction of labor.
Before we start with the questions, let's talk about what an induction or being induced is. An induction or being induced basically means that we are going to start your labor process before you are going into labor on your own. And this can happen for a multitude of reasons, which your doctor will explain further. Some of the examples are having high blood pressure or, for example, being overdue.
So here at Christiana, there's one main way that we like to induce people or put you into labor, and that is a Foley bulb. And many people ask us, what does that mean? So a Foley bulb is a way to mechanically dilate your cervix. So what we do is we thread a Foley catheter, or this device right here, up through your cervix. At the end, there is a balloon that we inflate, and the bottom portion of the balloon sits on the inside portion of your cervix and acts like the baby's head. The balloon slowly works its way through the cervix, and once it comes out, you're 3 centimeters dilated.
Patients often will ask us why they're getting a Foley bulb and not just Pitocin. I think that most people know that Pitocin is a medicine we commonly use on labor and delivery to make women contract. And it used to be that a lot of women would come in and just get Pitocin and that was it. Nowadays, with evidence, what we've learned is that if we can actually use this catheter to dilate your cervix a little bit and make it a little bit thinner before you get Pitocin, we'll give you the best chance of having a vaginal delivery.
One of the questions that we get asked is, what happens if I come to labor and delivery and I'm already dilated? Well, that depends on how dilated you are. If you're less than 3 centimeters dilated, you will likely get the Foley bulb placed as part of your induction. If you're greater than 3 centimeters dilated, you'll get started on Pitocin as part of your induction process.
So another common question we get is, will my Foley bulb induction ever be canceled? No, it will never be canceled. However, it may sometimes be delayed. While we do have a very large labor and delivery unit with over 20 beds, we can't always predict how many women will come in labor because we take care of such a large population of women. However, if there may be a delay in the start time of your Foley bulb, you will be called and told a different time to come in.
Women often ask us on labor and delivery if they're going to be able to eat during their induction, and sadly the answer is no. We would highly encourage you to have a nice large meal before you come into the hospital, but once your induction starts and the Foley bulb is placed, you'll be asked to stay in your bed for at least 30 minutes so the nursing staff and the doctors can watch you and watch your baby. But after that time, you'll be able to walk around if you're able to, and also you'll be able to drink as much as you'd like.
One of the most commonly asked questions is, will this hurt? I usually tell patients that it feels like a prolonged cervical exam, so it will be uncomfortable. And then when the Foley catheter is placed, you might experience some cramping. Often, once the Foley catheter is placed, you might actually start having some contractions.
In some situations, there are patients where we're not actually able to place the Foley bulb, and this can happen for a lot of different reasons. The most common we as the providers encounter is that the cervix is just closed shut and we can't get it to open at all. If that happens, the Foley bulb can be abandoned. There are many different ways to induce labor. You could rupture membranes, you could just start Pitocin, sometimes there are medicines we can give, and all of these serve to induce labor. At Christiana, we prefer to use the Foley bulb because it's easy, it's safe, it's generally very well tolerated, and it's reversible. If it causes any problems, we can just take it out. Each case is different, and no matter what, your provider is going to individualize your care to give you the best outcome.